All right, let's talk about mental health. 1 in 5 Americans experience mental illness every year, and I'm one of them. As a journalist, the last thing I want to do is make any story about myself. But as your neighbor and fellow human, it makes sense to share this part of me with you. This job requires that we put on a microphone and often a smile and bring you the news every day. It's a job that I love, but being on TV does not make me or my colleagues immune from life's challenges. For me, those challenges include anxiety and depression, and I share that to remind you of this. You're not alone, there's help, and there's hope. I'm joined now by sports anchor Dorian Kraft, who's here to help me shine a light on this, because it's something that we have in common and a lot of people at home probably have in common with us.
Yeah, Michael, you and I got to talking about this over dinner a couple of weeks ago, and I wanted to immediately be part of the conversation because, like Michael, I also suffer from mental illness. Last July, I was diagnosed with anxiety with depressive episodes, and it was certainly exacerbated by the pandemic that we all lived through, that we're still continuing to live through. But there were issues that I should have dealt with longer, and I didn't because I was afraid of the stigma of mental illness. I didn't want to be labeled as crazy. I didn't want to be labeled as emotional. And all of these things are things that so many people deal with, and sometimes they feel like they can't get help. And as soon as I was able to finally admit to myself that I needed help, things started getting better, and we want those opportunities for other people.
And that's something that I can relate to. I remember my first couple of therapy appointments, going in, being in the waiting room and thinking, oh my God, what if someone recognizes me? What if I see someone I know? And here we are a few years later talking about it on TV. Dr. Sasha McBain is a psychologist at UAMS, and she joins us here now. Dr. McBain, thank you so much for being here. We heard that stat, 1 in 5 Americans experience mental illness. How has the pandemic affected that number and affected the conversation surrounding mental illness?
Yeah, I think that a lot of people have been experiencing depression and anxiety that might be new to the pandemic or might be kind of worse because of all of the things that have been surrounding the pandemic. I think there's also been a lot of conversation about how there have been disparities or inequalities in mental health resulting from this experience. And so there's been much more open conversations about what people are going through and how we can potentially cope with it.
You talked about the more open conversations, and it does seem like there has been a willingness to at least speak about these issues, but how tough is it to continue to fight that stigma, especially here in the state of Arkansas?
Yeah, it's really hard because it's not just individual stigma, it's cultural, it's systemic. And so we need to, in order to address stigma, we really need to think about the big changes that need to happen in terms of how we talk about and how we access mental health. As an individual, though, I think that one of the first steps is to release some of the internal stigma, like you were saying, of recognizing that we need support and that that's not a character flaw.
Yeah. We hear about those barriers to care, that people have trouble accessing resources and accessing that help. So what resources are out there for people, maybe in rural areas or otherwise, who are struggling to find that help that they need?
Yeah, one of the great things that has come from the pandemic is the funding of something called RConnect, which is a free telemental health service that's available to anybody in the state of Arkansas. It's been a really wonderful resource, and you can access free care up to 6 sessions, and if you need or want more after that time, they can help you get connected with a clinician in your area. One of the really important parts as we move forward through the pandemic and the years to come is to make sure that we have local legislation or federal legislation that is continuing to allow access to telehealth and to pay for it, because that's one of the biggest things is obviously cost barriers.
Now, I know for me, I was very reluctant to seek help. I kept telling myself that I was in control, I could fix myself, it really wasn't that bad. And it wasn't until my husband asked me to go for him, because how my mental health was affecting not just me, but our marriage and him as well, that I actually went and sought treatment. So how do you have conversations with loved ones who need help but may be reluctant to seek treatment?
Yeah, it's a great question, and I think that we have to think about it as multiple steps. The first would be to kind of take some time to observe your loved one. You know, everybody has bad days, everybody goes through kind of low periods, and so kind of looking for those patterns. And then once you've kind of established that there is something to be concerned about, approaching them, stating your observations of and doing it as objectively as you can. A lot of times we get frustrated, we get to the point where you need to go to therapy, which can then put somebody on the defensive and they're not going to want to seek help. And so if you can kind of clearly state hey, I noticed that you've been more stressed when you come home, you haven't been as engaged with the kids, to kind of do it more objectively can release some of the pressure of the defensiveness, and then ask, does that make sense to you? Have you seen the same thing? Am I on the right track? And allowing them to respond, talking to you, clarifying what's going on, and then responding in a way that's affirming of, thank you for telling me this. And then sometimes people just need someone to talk to. Sometimes they need help with problem solving. And typically we go to the problem solving first. And so if we can talk to people about, like, what do you need from me? Do you need me to just listen? Do you need help with finding resources? And coming together to be collaborative in how you're getting help, and then helping to connect to a therapist can sometimes make it a little bit easier.
Such great advice. Well, we appreciate you being here, helping us have this conversation with our viewers, and hopefully we continue to have this conversation in the days and weeks to come. I said it once and I'll say it again, you're not alone.
No, if you are in crisis or wish to help someone else, the National Suicide Prevention Lifeline is available 24/7. That number is on your screen, 1-800-273-8255.
We posted that on THV11.com. We also have a list of mental health resources, including details on the R-Connect program there on our website. You can also text the word HELP to 501-376-1111. We'll send that directly to your phone.